Matt Hancock, the health secretary, was interviewed by Sky News and asked multiple questions about masks. And unfortunately, he pretty much dodges every one of them. So let's hear what he had to say.
Why are we waiting another week before we are asking the general public to put a mask on when they go into a shop?
Well, it is of course safe in shops, and we've currently got the guidance that people should wear a mask in shops, and
But that's not the question. The question is, why are you waiting an extra week? There isn't. What is? Well, we have a guidance that people should wear masks when they go into shops, but it's not mandatory. It's optional. She's asking you a simple question. Why are you waiting an extra week? Now, if he had come back and said, look, we're giving shops enough time to put up pictures, posters on the wall, guidance, they need to be, they need these guidance explained to them. Maybe they need a little bit of training, I don't know. We need to give them time to maybe purchase masks that they can place in their shops for people to use if they enter without a mask, so that they forgot and they need to put one on. I don't know. You could come up with 100 different reasons as to why you're delaying it for an extra week. But you're not. You're talking about something completely different.
Making that mandatory, I think it's a good step forward. It's all part of our strategy of trying to make the transmission of coronavirus as low as possible, whilst also allowing people to get back to the...
But that's nothing related to the question she asked. She asked a question about time. Why is it an extra week? Why are you waiting an extra week? I believe masks should have been mandatory in shops, in closed areas, for months now. But Boris Johnson's government is talking about implementing it at the end of this month. It's a bit late for that.
The sorts of things that they love to do, and restoring the good things in life that we had to unfortunately clamp down on during the peak. So it's all part of the overall programme.
This is just word salad. He's not responding to the actual question.
Overall strategy to keep the transmission of the virus down, whilst allowing other parts of life, like going shopping, to get going again.
Yeah, except the scientists. We did a montage, I don't know if you saw yesterday on Sky News, including Jonathan Van Tam, saying there was no evidence at all that masks made a difference. Did they get it wrong?
No, the scientists have been brilliant throughout this crisis, but part of science is that you constantly learn, and
But it's not about constantly... Okay, yes, you constantly learn, but you can admit that what they said was wrong. They had said something that was wrong, and now we have corrected it. I don't understand why you have to defend a particular scientist. Their position was wrong. Now we know better. We can say they were wrong. It's not a problem to say that they were wrong.
One of the things we've learned about this virus is that there's more asymptomatic transmission than anybody thought of, and there's also been developments in understanding of the spread. Now, on masks, it's a balanced decision, but there's benefit.
What do you mean there's a balanced decision on masks? Is there a negative? I assume you're going to explain a positive here. It's a balanced decision. So there's a benefit from wearing a mask, and there's a negative. Well, what is the negative of wearing a mask? And unless you're going to say it's sometimes uncomfortable, but I think that's a small price to pay for saving lives, no?
Of having a mask, especially a benefit to other people. If you are an asymptomatic carrier of coronavirus, you feel fine, you don't have any symptoms, but you do have the disease. Maybe it's before those symptoms.
But once again, this is irrelevant to the question that she asked. Were the people who said that not wearing a mask, or that wearing a mask made no difference, were they wrong? The simple answer is yes, they were wrong. But now we know better.
Symptoms have come through. It's now clear that you can transmit the disease. This is novel for a coronavirus, and the scientists didn't know this at the start. That's no criticism of the scientists at all. I mean,
we knew it was
Jonathan Van
airborne.
Tam.
And she's right. We knew it was airborne, but it's not about criticizing the individual scientists. When you said they were wrong, the information that they presented is wrong. It doesn't mean that you're insulting them or you're attacking them. If somebody told me today is Monday, and I said, no, actually today is Wednesday, or depends on when you're watching this video, today is Thursday. I'm not attacking the person by saying they're wrong when they say it's not Monday. I'm just stating a fact. By saying that these scientists were wrong when they said masks didn't make any difference, they were wrong. It's not a criticism of those individual scientists. It's a criticism of what they have presented.
No, didn't we, Health Secretary? We always knew it was airborne, didn't we? So it would make sense to wear a face covering. And we saw many other countries putting face coverings on, including Scotland, and yet we still didn't because the scientists were telling us not to.
Well, in Scotland, they're taking broadly the same decision at broadly the same time. That's what's...
No, they're not. Scotland are taking very different decisions. Scotland is not easing the lockdown in the same way as England is. Scotland has a different approach to mask wearing. So you can't just say, well, we're all the same. No, you're not the same. You should know it better than anyone.
What's happened across the UK throughout this is the whole of the UK has essentially taken the same decisions with some small distinctions.
Small distinctions. It's like, yeah, a small distinction such as we ended a lockdown and then Scotland remained in lockdown. Yeah, this is just a small distinction.
It's mostly about timing.
Why is there confusion then?
It's mostly about timing. Timing is the fundamental issue surrounding this pandemic. Countries that went into lockdown earlier were able to leave lockdown earlier because they were able to get hands on this virus. They were able to control it. They were able to fight it. Look at any country around the world. When a country dealt with it as soon as possible, they ended up with having fewer deaths, and they were able to end their lockdowns much sooner. Countries that let it run for much longer ended up with more deaths and a longer lockdown. Look at the United States, for example. Donald Trump dragging his feet for months, and now you see Donald Trump wearing a mask. After months and months and months of people asking him, wear a bloody mask, he refused to do it, and now he's doing it. But how many deaths has the US inflicted upon itself? Or Donald Trump inflicted upon it? I think currently it's almost 140,000 deaths because of Donald Trump's time wasting. So just dismissing it as, well, it's just a difference of time. Time is of the essence.
Because, I mean, I was chatting to your colleague George Eustace yesterday. He didn't know that it wasn't compulsory for a client to wear a face mask in a hairdresser's. He didn't know that. He was arguing that it was. It isn't, according to the rules so far. It may change, but up to today, it isn't. And your cabinet colleagues yesterday also seemed remarkably confused. I'm sure you've seen the front page of the...
Of course they're confused. Look at this. Matt Hancock Michael Gove not wearing a mask, and Liz Truss wearing a mask. Of course, it's just confusion. It's complete and utter confusion. The journalists know more about the rules than the politicians do. The politicians who are actually writing the rules.
The Telegraph today, where they're both coming out the same shop. One of them's got a face mask on, the other one hasn't. We spoke to the manager of that Pret store, and he says he's confused. The message is confused, isn't it?
Okay, this picture was before we'd announced the change in the policy. I announced.
Why are you laughing? I don't understand why this is funny. Matt Hancock seems to... I notice this in a lot of interviews, that when somebody paints him into his own corner, he's responsible for these rules. When somebody shows him evidence of a misunderstanding of these rules or confusion surrounding these rules, he responds with laughter. I find this quite sinister.
That's the change in the policy in the House of Commons yesterday.
Okay, so explain to me then. Who was right? Who would be right today coming out of that store?
Well, the advice until the 24th of July, giving businesses time to make sure that they can get...
So he can't answer the question. I'm laughing at him not being able to answer the question. He's laughing at him not being able to answer the question as well. But he should not be laughing.
Get their processes in place and make sure that we can...
You know, it's like if I go in to get surgery done and I say, well, you know, which part of my spleen are you going to remove? And the surgeon starts to laugh. That's serious. You know, I may laugh because he's laughing, but then I'll start to cry because I realize that he's laughing because he doesn't know what he's doing.
That we can implement this smoothly. The advice now is that face coverings are recommended in shops, but not mandatory. That's been the position for some time, and we're...
Why? Why are they recommended and not mandatory? I still don't understand if it's mandatory or if it's recommended. Because mandatory means if you don't wear it, there is a fine, there is a punishment. If it's recommended, well, please do it. But we've seen what recommended does. Recommending people not to go to the beach, people went to the beach. Recommending people maintain social distancing, people didn't maintain social distancing. Recommending people not to overdo it, people overdid it.
Tightening that up to say that they are mandatory from the 24th of July. So that's...
Let's use Pret as an example because that's the picture that we're looking at. From the 24th of July, do you need to wear a face mask coming out of Pret?
You do need to wear a face mask in Pret because Pret is a shop, and this is a...
But it's also a restaurant. You can sit down and eat there.
I was going to come...
I was about to come on to this. He's like going, oh shit, you're going to... Now you've got me again. Apologies. Yeah, I was about to come on to that. Yes, you were, Matt. You thought, okay, it's a shop. You have to wear a mask. That's it. Oh, no, wait a minute. You're telling me something. You're going to confuse me with my own rules once again.
You can eat in the restaurant, can't you?
Thank you, Kay. I was just going to come on to describe that. So in hospitality, so in a restaurant, there needs to be table service. If there's table service, then it is not necessary to have a mask. But in any shop, you do need the mask.
Why? If the problem... Does he think that the virus doesn't know the difference between, or cares about care about the difference between a shop and a restaurant? The virus doesn't go, whoop, there's a shop, I can't go in there because people will wear face masks. But look, there's a restaurant next door, or part of the shop has a restaurant, so I can go in there and spread. This is ridiculous. You need to say, when you are in a closed space with other people, you have to wear a mask. That's it. You know, you can take off the mask if you need to eat or to drink. But apart from that, you need to wear a mask. Why are you creating exceptions that defeat your own rules? You're saying, okay, when you're in a shop, you have to, but when you're in a restaurant, you don't have to. So if a shop and a restaurant are connected or in the same building, in the same room even, you'll have people who are wearing and who aren't wearing. It's just chaos.
So if you're going up to the counter in Pret to buy takeaway, that is a shop. That is Pret operating as a shop. But if you go to your local pub, you can't go to the bar. In fact, there have been stories of people putting, stopping people from going to the bar. You can't go to the bar, and the reason there is because of the risk of transmission over the bar, and therefore it's table service, and.
Okay, but why not just say, if you're inside, you have to wear a mask. If you're outside and you can't maintain 2 meters, you have to wear a mask. I think it's quite simple. I don't understand why he's trying to make it more complicated. Of course, there will be situations where people will have to take off a mask, or people, if somebody's having a heart attack or something, they'll have to take off the mask. But these are exceptional circumstances. But generally, we don't live in exceptional circumstances. Why are you making it more complicated? When you add complexity, it means people will not follow the rules. I think the whole idea behind it is to create confusion, so that later on you can blame the public for not following the rules. Oh, look, we have another spike. Well, it's not our fault because we told people to follow the rules. And they didn't follow the rules. We asked people to use common sense, but they didn't use common sense.
A mask is not needed,
Okay.
but when you go into a shop, a mask is needed, and law from the 24th of July.
Okay, I think that's clear. Blackburn.
You think that's clear? I don't think it's clear. Nobody thinks it's clear. I don't think even Matt Hancock thinks it's clear.
Are saying that people should wear masks in the office. Is that a good idea?
So we will not be recommending masks in the office, but I
wish he'd say because. Why not? People are in a confined space together. I know people are not purchasing anything or not walking in and out of the building, but if people are stuck in the same place, you should at least recommend it.
I respect what Blackburn have done. In fact, Blackburn has taken action locally because their rates of positive cases are higher than many other.
So you're saying that because... Okay. Let's just think about this for a moment. At the beginning of this video, he said that masks are necessary. He said these are his words. I'm paraphrasing, but these are basically the words he said. That you need to wear a mask because there is asymptomatic spread. So he said that people who don't know they're infected should wear a mask because it protects others. Once again, I'm paraphrasing what he said, but he said something to those on those lines. Now he's saying that people can be in offices and they don't have to wear masks because the R number is low, because we don't see any infection. But at the beginning you said people can spread even though they're not showing symptoms. So in a way you're saying that, well, if you don't have symptoms, you don't need to wear a mask. But at the beginning he said, if you don't have symptoms, it's a good idea to wear a mask. So which is it?
Other places around the country, and they're not as high as Leicester, but they are higher than the national average, and the council in Blackburn are doing a fantastic job at taking local action themselves to try to...
And this is another issue here. I'm sorry to be interrupting him every few seconds, but this is an interesting issue. He's talking about, yes, the local council are doing a bang-up job. They're doing a fantastic job. Once again, this is offloading the responsibility onto councils. It's not my business anymore. I just create the rules, but they have to deal with the aftermath. And if they're not doing a good job, well, I'm going to point it out. You are responsible at the top of all of this. The buck ends with you. You have to take responsibility. But once again, this is about offloading responsibility. Offloading responsibility onto the public, offloading responsibility onto councils.
To tackle the problems in Blackburn.
OK, let's whiz through another couple before I have to let you go. Sorry about the confusion about where you should have been this morning. Leicester, when are you lifting the lockdown in Leicester?
Well, we're taking the decision later this week. So by the end of the week, we will announce the next steps on Leicester.
But what is the criteria? Like you say, okay, we've implemented a lockdown in Leicester. Leicester had an outbreak and they locked down the town. What is the criteria for easing the lockdown or ending the lockdown in Leicester? Must say like, okay, when the infections have gone down to 0, when the number of new cases in Leicester have reached 0 or close to 0, then they will be allowed to end their lockdown. But what is the criteria?
To make any changes, and if so, what changes to make. That'll all be driven by the data and our assessment of how well the team are doing locally.
Capital gains tax?
Like, really, maybe I'm being too cynical here. It's like, yes, we're monitoring the data and we're going to keep an eye on it and we're going to let you know later in the week. Okay, but what is the criteria? I think there should be some criteria, and I don't think it's necessary to hide this criteria from the public. To say, when it arrives at this point, then they can ease the lockdown. I think it would be good for other towns that are probably going to see spikes in the future to know when they can ease the lockdown. You know, when the number of new cases has stayed at 0 for a week, I think that's a reasonable requirement because, you know, restaurants, businesses, they would like to reopen, I imagine. Life would like to return to normal. If people know the criteria, then we can plan for the future. But you're not giving them the criteria.
Apparently, your colleague, the Chancellor, reportedly looking to raise capital gains tax to claw back some of the money that it's cost us to fund the COVID crisis. Any truth in that?
As far as I understand, there is no proposal, and there is the Chancellor is not looking at tax changes now. We've just had the summer economic statement, and apparently reviews like this are normal all of the time and not connected to any decision one way or the other.
OK, a particular bugbear of mine, I don't often get a straight answer to this, but the Health Secretary will know the answer. Clapping for carers and thank you NHS doesn't extend to paying for their parking. It did during the height of COVID. It's not going to now. Is that right or not?
That's not right now. The free parking is extended. And you know, that's an important thing that we've done during the crisis. And we're in fact also putting money into building more car parks next to hospitals because it's not just the staff who want to park, it's the patients who need to be able to park as well. At the moment, there's very few visitors to hospitals because of the infection control procedures. And so so we've been able to do this for staff.
OK, final thought.
Okay, she asked another question, a very important question there, but he didn't hear it, was until when? Shouldn't it be indefinitely? Forever? We're never going to charge NHS staff for parking. Why are you charging NHS staff for parking? So I uploaded a video about this recently, about why should anyone have to pay for parking at a hospital? And some people said, rightly, that members of the public would probably abuse it. They would park there and then go shopping or something. And I understand that point. But why should staff have to pay to park in their place of work? I don't know of any other situation where somebody has to pay for parking in their place of work. You know, parking on the street outside your office or wherever you work is understandable. But if your company has a car park, you normally don't have to pay for that. Why do NHS staff have to pay to park their cars in their place of work? I would like Matt Hancock to explain that. I'd like anyone to explain that. I don't see the sense in that. charging members of the NHS, who you clapped for, to park in their place of work. Now, he hasn't said when this will be extended to. I think it should be indefinite. They shouldn't exist. They should be compensated for the years that they actually had to pay for parking. It's completely ridiculous that they had to pay for parking. But of course, as some people have pointed out in the previous video, the parking is outsourced to a private company in many cases. And it's them that's profiting from this, not the NHS.
We're hearing more and more about long-term effects of COVID and multi-organ damage, extreme fatigue, etc., etc. Given that you suffered from it, are you concerned?
I am concerned. Thankfully, not for me. I'm fine. But I am concerned. There's increasing evidence that a minority of people, but a significant minority, have long-term impacts, and it could be quite debilitating. And so we've set up an NHS service to support those with long-term impacts of COVID. And also we've put almost £10 million into research into these long-term effects. So it is something that I'm worried about. We've taken action on both through the NHS and through the...
And if this is true, I commend Matt Hancock for doing this. I think this is a good idea. It's very important to understand the long-term effects this is going to have on many people. Many people who have recovered have serious health issues. And I think it's very important for the NHS or hospital medical systems around the world to be able to have the resources to look into this, to research it, to understand what impact it has on patients, on vital organs. There are cases of people having damaged lungs and even brain damage because of COVID. Now, I don't know if it's because of the virus itself or because of the aggressive treatments they've received in hospital to save their lives. But anyway, I do welcome this, and I do commend Matt Hancock if this is true. I commend Matt Hancock for doing this. I think it's important and it should be welcomed. So I'm going to stop the video here, guys. That's all I have to say on this. Thanks for listening. Unfortunately, this whole issue of masks is extremely confusing. It's going to create chaos because some people will walk into a shop that has a part of it which is a restaurant, or walk into a restaurant that has part of it that is a shop, and people will not know whether they're supposed to wear a mask or not. And sadly, there was news of a £100 fine for people who don't wear a mask. £100. As someone said in the comment section on one of the videos, it's a bigger fine for driving an electric scooter than on the footpath than actually for not wearing a mask. Let me know in the comments, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot. Why not become a Patreon and enjoy access to our Discord server where we share news, chat, and have some fun. If you become a patron, you can also make video suggestions on topics that are important to you. Check it out via the link in the description.